Yoga for breathing disorders. Section 1. Hatenas to increase breath capacity and efficiency in the low chest area. Adam Pranayama. The group of Hatenas based on Ushtrasana, the camel pose, help force the inhaled air primarily into the lower lung area, expanding and stretching the lung tissue. These Hatenas condition the respiratory system to perform conscious and efficient low chest breathing known as Adam Pranayama. Use the Adama Sparsha Mudras to consciously move your breath into the low area of your chest, breathing into the front, the side, and the back areas of your lower lungs. Focus your attention on lung areas related to each hand position and breathe deeply. Perform a few rounds of the Adam Pranayama before doing the Hatenas for this area, and then repeat the Adam Pranayama at the end of the practice to see the difference. Sapurna Ushtra Asana Variation 1. To perform the first variation of the incomplete version of the camel pose, sit on your heels in Vajrasana and gently expel your breath. On an incoming breath, lift off your heels and come up onto your knees. Keep your back straight when you are coming up. Back bend gently with your arms dangling by your sides without any strain on your arms. Breathe in and out while holding this final position. Keep your eyes open to avoid fainting or falling over. When ready, on an out breath, slowly come back to the Vajrasana and sit down. Repeat the practice at least 3 times at each sitting. Breathe in 1, 2, 3, 4, 5, 6. Hold the pose. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Hold. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Hold. Breathe out 1, 2, 3, 4, 5, 6. Relax in the Vajrasana and enjoy the enhanced flow of air that will move primarily into your lower lung area. Sapurna Ushtra Asana, variation 2. From the heel sitting Vajrasana, take your hands behind your body and rest the weight of your body on the palms of both hands. Turn your hands inward so that the tip of your fingers are in touch with your toes. Relax your head and neck so that your head dangles back between your shoulders. Relax and expel the breath. On an incoming breath, raise both buttocks off the heels and go into the highest arch possible, suggestive of a camel straining to arise from its sitting position. The arch should come from your lower back in trying to push your back up as high as possible. When ready, slowly sit down while expelling the breath. Repeat the second variation of the incomplete camel pose at least 3 times at each session. Breathe in 1, 2, 3, 4, 5, 6. Hold the pose. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Hold. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Hold. Breathe out 1, 2, 3, 4, 5, 6. Slowly come back up to the Vajrasana and relax with some deep abdominal breathing for a few minutes. Purna Ushtrasana. Purna Ushtrasana, the classical version of the camel pose, is done from the heel sitting Vajrasana. On an incoming breath, raise your body off your heels and come up onto your knees. Keep your eyes open and slowly back bend. Take your hands back and catch hold of your heels with both hands. Push your lower back forward to help attain a good posture. Once you have reached this final position, do half a dozen forceful Bhastrikas with total awareness on the movements of your diaphragm. Breathe in through your nose and blast out through your mouth. This practice is known as the Nasarga Mukha Bhastrika. When ready, slowly sit down while expelling the breath and attain to the Vajrasana. In the beginning, do this posture and pranayama only once. Then, after a week's practice, it may be done twice. And finally, it may be done 3 times after a fortnight of regular practice. It is important that you keep your eyes open in order to avoid fainting or falling over, especially in the beginning, as your brain has to get used to the new patterns of circulation that occur in this posture. The camel poses stretch the spinal column and produce a healthy spine. Resilient back muscles, as well as a strong diaphragm and solar plexus, are produced, building up physical power, endurance, and resistance to disease. They also massage and stimulate the abdominal organs through the extensive movements of the diaphragm. Slowly come back to the Vajrasana and relax with some deep abdominal breathing for a few minutes. Sapurna Shasha Asana. The incomplete rabbit posture helps us to direct the inspired air into primarily the lower area of our lungs. Sit on your heels in Vajrasana and bring your hands forward to place your elbows onto the ground directly in front of your knees. Extend your forearms with both palms facing down on the ground. Your elbows should be touching your knees. Raise your head and bend your neck as much as possible. Breathe in and out as deeply as possible for 3 to 6 rounds. Feel the positive tension that develops against your diaphragm as you breathe deeply in this position. After a few rounds of deep breathing, release your head and let it dangle forward for some relaxation. After performing the practice as required, relax the pose and slowly come back to the Vajrasana. Perform some head rolling and head turning to release any strain that may have accumulated in your neck during the practice. Repeat the Sapurna Shashasana with breath awareness twice more to complete a set of 3 rounds at each sitting. Section 2. Hatenas to increase breath capacity and efficiency in the middle chest area, Madhyam Pranayama. A regular practice of the Hatenas associated with mid-chest breathing ensures a healthy, strong heart capable of maintaining a healthy blood pressure and vigorous circulation. Pranic energy is stimulated to flow into the mid-chest area, and the intercostal muscles and lung tissue are strengthened and reconditioned. Perform Madhyam Pranayama by breathing into your mid-chest area. Breathe into the front, then the side, and then the back areas of your mid-chest, while indicating the concerned areas with the Madhyama Sparsha Mudras. Focus your attention on the lung area related to each hand position and breathe deeply. Perform a few rounds of the Madhyam Pranayama before doing the Hatenas for this area. Repeat the Madhyam Pranayama at the end of the practice to feel and see the difference. Sapurna Matsya Asana. Lie down on your back in the Shavasana with your heels together while your hands are kept relaxed at your side. To perform the incomplete fish posture, sit up into the Uttanasana with your palms on the ground alongside your body. Bend your elbows and relax back until your body is fully supported on your elbows that are kept flat on the ground. Let your head fall back in a relaxed position and lift your chest to arch your back as high as possible. Once you have attained this final position, start to breathe in and out in a regular and deep manner. This forces the breath to move primarily in the middle area of your chest, stretching the mid-lungs and massaging the heart. After performing at least 3 to 6 rounds of deep breathing in this position, come back up to the Uttanasana and then slowly return to the Shavasana. Start to roll your head from side to side to dissipate any tension that may have been created in your neck from this posture. Ardha Matsyasana. To perform the half version of the fish posture, lie down in Shavasana with your heels together while your hands lie loose alongside your body. Lift your hands over your head and use them to lift your shoulders off the ground. Come into a high back arch until the top of your head carries the entire weight of your torso. After attaining a steady pose, relax your arms down to the ground alongside your thighs. Place your palms onto the top of your thighs and perform deep and controlled breathing for 3 to 6 rounds in this final position. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. When ready, lift your hands off your thighs and use them to release your head. Relax your back onto the ground in Shavasana. Perform a few rounds of gentle head rolling from side to side to relieve any tension that may have accumulated in your neck from this posture. Matsya Asana. The classical Matsya Asana is done with the legs locked into Padmasana, the lotus posture, but a beginner may also use a loose or easy cross-legged position like the Sukhasana. From Shavasana, sit up straight with your legs stretched out in front of you. Fold up your legs and perform the Padmasana. Place your palms on the ground alongside your body. Bend your elbows and relax backwards until your elbows are flat on the ground. Support your body with your forearms and let your head fall back in a relaxed position until it touches the ground. Perform an exaggerated supine back bend and force your shoulders off the ground so that the weight of your entire torso is well balanced on the top of your head. Place your hands on top of your thighs while keeping your elbows on the ground. If possible, catch your toes with your fingers while bringing both your elbows down to the ground. Breathe deeply and discover that the air flows mostly in your mid-chest area, relieving congestion and repairing faulty breathing habits. The heart and great vessels of your thoracic cavity get a healthy massage when you breathe deeply in this position. The muscular walls of the heart are also strengthened, thus ensuring efficient functioning. Perform at least 3 to 6 rounds of deep breathing in this position before returning back to the Padmasana or Sukhasana in a careful step-by-step manner. Unlock your feet and stretch them forward into the Uttanasana. Slowly return to the supine Shavasana. A couple of rounds of head rolling from side to side in Shavasana can help release any pent-up tension in the neck that may occur after performing the fish posture. Purna Shashasana. The complete rabbit posture helps us to obtain conscious control over the process of mid-chest breathing. From Vajrasana, bring your hands forward and place your palms on the ground directly in front of your knees. Your wrists and knees should be as close as possible. Keep your arms straight and apply a considerable pressure against the ground. Lift your head and look up as far back as possible. Perform 3 to 6 rounds of deep and controlled breathing into your mid-chest while holding this final position. After performing the required rounds of breathing, let your head relax onto your chest for a few seconds before repeating the practice 2 more times at each sitting. After performing 3 rounds of the practice, release the position and come back up to the Vajrasana. Place your palms back on your thighs and perform a few rounds of head rolling in a circular manner, clockwise and then counterclockwise. This helps to dissipate any tension accumulated in your neck and shoulder region. Section 3. Hatenas to increase breath capacity and efficiency in the upper chest area. Adyam Pranayama. This set of Hatenas forces the air to move primarily in the upper lung area, helping to expand the lung capacity and strengthen lung tissue. This creates good upper lung breathing habits that prevent and relieve numerous disorders of the head and neck. Adyam Pranayama is performed by breathing deeply into the front, the side, and the back areas of the upper chest, while indicating these areas with the sparsha mudras or touching gestures. Focus your attention on the lung area related to each hand position and breathe deeply. Perform a few rounds of the Adyam Pranayama before doing the Hatenas for this area, and then repeat the Adyam Pranayama at the end of your practice to see the difference. Sapurna Mahamudra. Mahamudra, the mighty gesture, is employed to effectively release air trapped in the upper lobes of the lungs by using both hands like the handle of a pump set. Sit in a straight-backed Vajrasana with your arms by your side. Take in a deep breath and fill your lungs as much as possible at this point. Release your breath slowly and bend forward until your head touches the ground in front of your knees. At this point, as much air as possible should have been exhaled. Raise both arms high towards the sky above your shoulders with your hands open in the incomplete Mahamudra. Perform a pumping action with your hands in this position to help force out any stale air trapped inside. Rest in this forward position with no breath for a few seconds, and then lower your arms. When ready, begin a torso lift, drawing the breath into the low, then the mid, and then the upper chest areas to attain to the beginning position. Repeat this practice 6 to 9 times at each sitting until the high chest area is completely relaxed by the breathing action. The problem of the chronic asthmatic is not so much that he cannot breathe, but that he has air trapped in the high chest, and this tension must be released before normal breathing can be restored. Mahamudra helps to pump out the stale air trapped inside by using both hands like the handle of a pump set. It is important to remember that the pumping action is performed on the held out breath. You must not breathe in during the pumping movement of the arms. The in-breath must only be taken when you are ready to come back up to the sitting position. After performing 6 to 9 rounds of this practice, come back to the Vajrasana and enjoy the relaxed feeling that spreads through your whole upper chest region as a result of this practice. Purna Mahamudra. To perform the complete version of the mighty gesture, sit in Vajrasana and entwine the fingers of both your hands behind your back. Pull your shoulders back and take in a deep breath. On the outgoing breath, bend forward and bring your head onto the ground in front of your knees. On the held out breath, lift your entwined arms and perform a pumping action to force out any stale air trapped in your upper lungs. Continue the pumping action until you feel that your lungs are completely empty. Slowly come back to the Vajrasana while breathing in. Repeat the practice at least 6 to 9 times at each sitting. Mahamudra helps obtain conscious control over the process of tidal breathing. It is particularly useful in the control of upper lobular breathing, that is often the main problem of patients of chronic breathing disorders. The spinal column, shoulders, and neck are also energized by the use of the arms in this practice. After completing the required number of rounds, come back up to the Vajrasana and relax your entwined hands. Place your palms on your thighs and perform a few rounds of deep and relaxed breathing while enjoying the feeling of relief spreading through your entire upper chest region. Bala Asana. To perform the child posture, take up a comfortable heel-sitting Vajrasana. Come forward into the four-footed Chatushpadasana with your weight balanced equally between your two hands and knees. Slowly relax your elbows until they are flat onto the ground and place your chest down in between your elbows. After attaining to this position, turn your head to your right and rest like a baby. Perform 3 to 6 rounds of simple deep breathing while concentrating your breath into the upper lobes. This position is very relaxing and offers excellent gravity-aided drainage of secretions from the upper lungs. After completing 3 to 6 rounds of the practice with your head to your right, turn your head to your left and repeat the breathing routine 3 to 6 times. Compare the marked difference in the pattern of upper lung respiration that occurs when you turn your head to the left as opposed to the right. When ready, slowly turn your head back to the center and then push on your elbows to come back into the Chatushpadasana. Stay a few seconds in this pose and then come back to the heel-sitting Vajrasana. The Balasana is named after the pose that babies adopt naturally when having difficulty in breathing. Let us learn from the babies and become childlike in developing our innocence as well as enthusiasm for life. Paripurna Shashasana. The extended rabbit pose is a hatena specially designed to force the breath into the upper chest regions. It is a bit hard on the neck and is better avoided in patients suffering from neck pain and degenerative disorders of the neck. Take in a deep breath while sitting in Vajrasana. Bend forward into Dharmikasana, the devotional posture on the out breath. Place your forehead on the ground with your nose resting between your knees. On an incoming breath, lift off your heels and carefully roll forward onto your head as if performing a semi-somersault. Be careful that you don't roll over fully. When ready to breathe out, come back onto your heels and perform Dharmikasana while breathing out. Breathe in and slowly come back to the upright Vajrasana. Please note that it takes 2 complete cycles of deep, slow, rhythmic breathing to do this practice correctly. The complete cycle may be repeated 3 to 6 times to obtain the maximum benefit. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. After completing the required number of rounds, relax in Vajrasana for a few minutes and perform mild head rolling, first in the clockwise direction and then the counterclockwise direction. This will help relieve any neck tension that may have accumulated while performing this excellent practice. It is important to remember that those suffering from severe neck problems must not do this practice as it may aggravate their condition. Section 4. Hathenas to increase breath capacity and efficiency in the whole lung area. Mahat Yoga Pranayama. The Hathenas performed from the 4-footed Chatushpadasana are designed to help produce a strong and powerful respiratory system. These practices help condition our body to deep, controlled and complete breathing in which all sections of our lungs are used to the fullest capacity. To perform Mahat Yoga Pranayama, the grand yogic breath, place your right hand in the Adama Sparsha Mudra on your diaphragmatic region and your left hand in the Madhyama Sparsha Mudra at the mid-chest. Start a long, slow, deep breath, regulating the first 2 counts to the low lung area. Continue the breath into the mid-chest for another 2 counts and then fill the upper lungs for the next 2 counts while bringing the right hand into the Adhyama Sparsha Mudra over the clavicular area. Then let the breath out in the same order. First, deflating the low, then the mid, and then finally the upper lung areas sequentially. Perform a few rounds of the Mahat Yoga Pranayama before doing the Hatenas for this area, and then repeat the Mahat Yoga Pranayama at the end of the practice to see and feel the difference. Sharabha Asana. The Sharabha Asana, or the griffin posture, is named after the mythological creature that had the face and wings of an eagle and the body of a lion. Take up a comfortable and stable Chatushpadasana. While breathing in, stretch your right leg straight back along the ground and lift it as high as possible. Lift your head as high as possible and lower your abdomen with an exaggerated back bend at the same time. Start to breathe out and bring your leg back to the ground and perform the Chatushpadasana with your head looking down. Perform 3 to 6 rounds of this action with emphasis on lifting your leg on the in-breath and lowering it on the out-breath. After completing the practice with the right leg, perform the left side to produce a balanced effect on both halves of your body. Lift your left leg and head in the same manner, creating an exaggerated back arch while breathing in. While breathing out, slowly lower your leg back to the Chatushpadasana. Perform 3 to 6 rounds of this action with emphasis on lifting your leg on the in-breath and lowering it on the out-breath. It may be noted that there is a tendency for the breath to come more deeply on one side than the other while doing this practice. This practice is also excellent for gaining or regaining spinal health. In these postures, there is a tendency to breathe into the lung of one side more than the other. This offers an excellent yoga therapy for those who have overdeveloped the lung of one side at the expense of the other. The lungs will now operate like a pair of oxen yoked together for their work. After completing the required number of rounds on both sides, relax back in the Chatushpadasana for a few rounds of relaxed, deep breathing. Chiri Kriya. This excellent breath and body movement coordination activity, named after the cricket, is performed from the Chatushpadasana. Take in a long, slow and deep breath and stretch your right leg straight back along the ground. Lift it as high as possible and look up as if performing the Sharabhasana. On the out-breath, let your leg come back down and add an exaggerated high back arch. Continue the movement and draw your right knee in under your chest and lower your head until your forehead touches your knee. Again breathe in and lift your right leg high into the back arch while lifting your head, and then bring your leg down and touch your knee to your forehead while breathing out. Perform this complete cycle of the cricket movement 3 times on the right side before relaxing back to the Chatushpadasana. To obtain equal benefits for both sides, perform the practice on your left side. Take in a long, slow and deep breath and stretch your left leg straight back along the ground. Lift it as high as possible and look up as if performing the Sharabhasana. On the out breath, let your leg come back down and add an exaggerated high back arch. Continue the movement and draw your left knee in under your chest and bring your forehead in to touch your knee. Breathe in and lift your leg high into the back arch while lifting your head up, and then bring your leg down and touch your knee to your forehead while breathing out. Perform this complete cycle of the cricket movement 3 times on the left side before relaxing back to the Chatushpadasana. There will be a tendency for the breath to flow more deeply on one side than the other while doing this practice, as the air is forced into the lung of that side. Spinal health is developed by the regular practice of this breath movement cycle that can even be quite meditative and contemplative when done in a slow and steady manner. Vyaghra pranayama. The tiger breath action is an excellent way to strengthen the diaphragm and contributes to complete breathing by utilizing all 3 parts of the lungs. Come into the 4-footed Chatushpadasana and make sure that your body is parallel to the ground. Take a deep in breath and let your abdomen sag towards the ground while lifting your head up high. Your back should present an exaggerated concavity while doing this action. While exhaling the breath, arch your back up as high as possible and lower your head in between your arms and shoulders. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4, 5, 6. Breathe out 1, 2, 3, 4, 5, 6. Simulating the breath action of the giant cats, this breathing routine is highly recommended to increase the breath capacity and to produce stamina and physical beauty. The Vyaghra pranayama is an excellent tonic for joint pains and the prolapse of internal organs. It helps in the rehabilitation during pregnancy and post-delivery conditions. Repeat the entire sequence 6 to 9 rounds before resting back onto your heels in the Vajrasana for some relaxed breathing. Section 5. Pranayamas to improve cardiorespiratory function. Mukha Bhastrika. Mukha Bhastrika is a yogic technique in which the breath is blasted out through the mouth in multiple whooshes. It helps to improve the expiratory power that is usually inadequate in patients of chronic lung disorders. Sit in Vajrasana and take a deep breath, filling all 3 parts of the lungs. Pucker up your mouth to form the Kaki Mudra. Start to blast out your breath in multiple whooshes while slowly bringing your head down to the ground. Slowly come back to the Vajrasana while taking a deep inhalation and repeat the process of blasting out while bringing your head to the ground. Perform this practice 3 to 9 times at each sitting. After performing the required number of rounds of Mukha Bhastrika, relax in the Dharmikasana with your nose in between your knees. Keep your arms alongside your body and catch hold of your heels. Let your elbows relax to the ground. Concentrate on the point of your forehead that is touching the ground and visualize yourself in a positive, happy and healthy state of body, emotions and mind. Make a conscious effort to be as positive as possible. When ready, slowly come back up to the Vajrasana while breathing in and relax for a few minutes. Anunasika Pranayama. Anunasika is an excellent practice for those suffering repeated upper respiratory infections. Sinus problems can also be effectively tackled as well as nasal allergies. Sit in Vajrasana with your palms placed on your thighs. Take in a deep breath and then eject it through both nostrils with multiple blasts. Repeat a second time by breathing in 1, 2, 3, 4, 5, 6. Blast out the breath. Repeat a third time by breathing in 1, 2, 3, 4, 5, 6. Blast out the breath. This practice can be done 3 to 6 times before going on to the next part of this pranayama. Perform the Nasarga Mudra and close your left nostril with your ring finger. Take in a deep breath and then eject your breath through your right nostril with multiple blasts. Repeat a second time by breathing in. 1, 2, 3, 4, 5, 6. Blast out the breath. Repeat a third time. Breathing in. 1, 2, 3, 4, 5, 6. Blast out the breath. Release the Nasarga Mudra and bring your hand to rest on your thigh. This practice can be done 3 to 6 times before going on to the next part of this pranayama. Perform the Nasarga Mudra and close your right nostril with your thumb. Take in a deep breath and then eject your breath through your left nostril with multiple blasts. Repeat a second time. Breathing in. 1, 2, 3, 4, 5, 6. Blast out the breath. Repeat a third time. Breathing in. 1, 2, 3, 4, 5, 6. Blast out the breath. Release the Nasarga Mudra and bring your hand to rest on your thigh. This practice can be done 3 to 6 times before going on to the final part of this pranayama. Complete the practice of Anunasika with 3 to 6 rounds of blasts through both nostrils. Breathe in. 1, 2, 3, 4, 5, 6. Blast out the breath. Breathe in. 1, 2, 3, 4, 5, 6. Blast out the breath. A daily nasal cleansing routine may also be adopted in consultation with a yoga therapist to benefit those suffering repeated upper respiratory infections, sinus problems, and nasal allergies. Kukriya Pranayama. Kukriya Pranayama, the dog pant breath, is an excellent cleanser and tones up the diaphragm and other muscles of respiration. Sit in Vajrasana with the weight of your body firmly on both heels. Place your palms on the ground in front with your wrists touching your knees and the fingers pointing forward. Open your mouth wide and push your tongue out as far as possible. Breathe in and out at a rapid rate with your tongue hanging out of your mouth. After 10 to 15 rounds, relax back into the Vajrasana and feel the blood flow into your abdominal area. Repeat the whole practice 3 more times. The diaphragm and other muscles of respiration get an excellent workout in this pranayama. The force of expiration is improved, and this helps to lessen the burden of the problem for patients of chronic lung disorders. Surya Pranayama. Sit in Vajrasana and perform Nasarga Mudra with your right hand. Close your left nostril with your ring finger. Inhale slowly through your right nostril for a count of 4. 1, 2, 3, 4. Now exhale through the right nostril for a count of 8. 1, 2, 3, 4, 5, 6, 7, 8. Keep your left nostril closed all the time during this practice. Breathe in. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Repeat the Surya Pranayama for a minimum of 9 rounds at each sitting. This pranayama has a sympathetomimetic action and helps to relieve the bronchospasm that is inherent in all chronic obstructive lung disorders. For maximum benefit, it should be performed 27 times before breakfast, before lunch, before dinner, and before going to bed at night. Pranava Pranayama. This pranayama uses the sound of the Omkara and has unlimited healing potential. It harmonizes the body, emotions, and mind and is an important part of the Rishi culture Ashtanga Yoga tradition as taught by Yoga Maharishi Dr. Swami Geethananda Giri. In this practice, emphasis is placed on making the sound A, U, and while breathing out for a duration of 2 to 3 times the duration of the inhaled breath. To perform Adam Pranayama, the abdominal or low chest breathing, perform Chin Mudra and place the mudra on your thighs. Breathe in into your lower chest area. 1, 2, 3, 4, 5, 6. Breathe out with the sound Breathe in. 1, 2, 3, 4, 5, 6. Breathe out. Breathe in. 1, 2, 3, 4, 5, 6. Breathe out. To perform thoracic or mid-chest breathing, the Madhyam Pranayama, curl your fingers inward to form the Chinmaya Mudra. Place the mudra on your thighs and breathe in deeply into your mid-chest region. 1, 2, 3, 4, 5, 6. Breathe out with the sound Oo. Breathe in 1, 2, 3, 4, 5, 6. Breathe out. Breathe in 1, 2, 3, 4, 5, 6. Breathe out. Adhyam pranayama, the clavicular or upper chest breathing, utilizes Adi Mudra. Clench your fists with your thumb in the center. Keep the mudra on your thighs and breathe deeply into your upper chest and clavicular regions. 1, 2, 3, 4, 5, 6. Now exhale with the sound Breathe in 1, 2, 3, 4, 5, 6. Breathe out. Breathe in 1, 2, 3, 4, 5, 6. Breathe out. Joining the earlier three parts of this practice in a complete yogic breath is the fourth stage, known as Mahat Yoga Pranayama. Perform Adi Mudra and then place it with the knuckles of your right and left hands touching in front of your navel. This is now known as the Brahma Mudra. Take in a deep breath into the low, into the mid, and into the upper chest regions. Now let out the breath with the sounds of Ah, Oo, and Breathe in 1, 2, 3, 4, 5, 6. Breathe out. Breathe in 1, 2, 3, 4, 5, 6. Breathe out. A performance of 3 to 9 rounds of the Pranava Pranayama, when done daily, helps to relax the body, emotion, mind complex and provides complete healing through the production of healing vibrations at all levels of our existence. This is the cornerstone of yogic breath therapy and produces health and well-being for all. Shavasana, relaxation for the body and mind. Shavasana is a relaxing and energizing posture in which the body, emotions and mind are united in the process of conscious relaxation. 15 minutes of Shavasana, when properly performed, is equal to more than an hour of refreshing sleep. Lie supine on the ground with your head preferably to the north, enabling your body to be in alignment with the Earth's electromagnetic field. Make sure that your head and body are in a straight line, while your hands are kept relaxed by your side with the palms facing up. Bring your feet together and then let your 4 feet fall into a V shape with your heels as close together as possible. Start to consciously watch your breath by letting your awareness settle in the abdominal area. Feel the abdominal movements as your abdomen rises when you breathe in and falls as you breathe out. After a few rounds of this practice, slowly let your awareness settle at the tip of your nose. Feel the cool inspired air flowing into your nostrils as you breathe in, and become aware of the warm expired air flowing out of the nostrils when you breathe out. Consciously regulate your breath so that the duration of the incoming and outgoing breath are equal. The inspiration and expiration can be for a count of 4 or 6 initially, and then with practice elongated to a count of 8 or 10. Perform at least 9 rounds of this conscious deep breathing and enjoy the relaxed sensation spreading throughout your body. The relaxation in Shavasana can be further deepened by utilizing Savitri pranayama to relax and rejuvenate your body, emotions and mind. Breathe in through your nose for a count of 6. Hold in the breath for a count of 3. Breathe out through your nose for a count of 6. Finally, hold the breath out for a count of 3. Make sure that you are breathing in and out through both nostrils and that you are using the complete yogic breathing. Perform at least 9 rounds of this combination practice that heightens the relaxation to a very deep level. Breathe in 1, 2, 3, 4, 5, 6. Hold in 1, 2, 3. Breathe out 1, 2, 3, 4, 5, 6. Hold out 1, 2, 3. Breathe in 1, 2, 3, 4, 5, 6. Hold in 1, 2, 3. Breathe out 1, 2, 3, 4, 5, 6. Hold out 1, 2, 3. Breathe in 1, 2, 3, 4, 5, 6. Hold in 1, 2, 3. Breathe out 1, 2, 3, 4, 5, 6. Hold out 1, 2, 3. After performing 10 to 15 minutes of the Shavasana, slowly start to move your fingers and toes. Perform conscious stretching and make a smooth transition from the relaxed to the active state. Lift your left arm over your head and turn over onto your left side. Continue this turning action until you come into the face prone posture. Perform Makarasana, the crocodile pose, by placing your right hand on the left, while the left is placed palm down on the ground in front of you. Keep your forehead or chin on your right hand while keeping your feet a foot apart. Bring your hands forward near your shoulders and push yourself back into the Bhujangasana. Continue the back bending movement and go into the four-footed Chatushpadasana. Relax into the Shashangasana with your arms stretched out in front, and then finally slowly come back to the heel-sitting Vajrasana. With your palms on your thighs, sit quietly for some time and enjoy the effects of the deep relaxation that has spread to every part of your body.